In this video, we'll talk about a common cause of both back pain and belly fat that just feels a little bit extra. And then we'll go through a sequence to address both at once. We'll also talk about why the first things you might think of doing, ab crunches for abdominal strength, and something like a forward bend to stretch out the tight back, could actually be some of the worst things that you could do. The very last exercise is the most powerful one, but everything else layers up to and prepares for it. So I hope you'll not just watch, but go through the whole thing all the way to the end and feel what a difference it makes. All right, quick visual aid. You can see the lumbar spine here in between the rib cage and the pelvis, these 5 big vertebrae. In between the vertebrae, those lines that you see are the discs. Ideally, those discs are like fluffy pillows, and they give our movement cushioning. Also, the more cushioning and space we have, the more mobile we are. But it's easy to picture how time plus gravity plus maybe sitting with not the greatest posture, those spaces just get a little bit squashed. So this distance from your pelvis to your rib cage gets shortened down. Now our soft tissue will adapt to whatever position it's habitually in. So as our structure shortens down, then all of the muscles around the spine are adapting by shortening down as well. And then that's reinforcing that shortened position. Now one more thing to visualize, we lose space in this dimension, we have to take up more space this dimension. But whatever fat we naturally have is going to feel like a lot more as everything is getting pushed from the inside outward. And the things that we typically think of doing, like a bunch of ab crunches or stretching our back, say in a forward bend, in this context are not great things to do, at least not good to do first. Because if I'm all shortened down here and then I start contracting my abdominals repeatedly, I'm just compressing this space further if I haven't done anything to lengthen the spine first before then engaging the abs. So let's look at what to do instead. Definitely recommend grabbing a cushion so your knee is completely comfortable as we kneel down. And let's think of stacking ourselves up pretty upright, head over hip over knee. This front leg is out at 90 degrees and a little bit off to the side for balance. Now, I'm not trying to do a big movement. More than anything, I want to look for this glute muscle and just squeeze it as hard as I can, and even just starting to tighten up the glute. So I'm just squeezing back here as hard as I can. You might feel that that pushes your pelvis forward a little bit, but what you don't want to do is start to angle way out. Let's stay stacked up, and let's say that we'll exhale and contract. Inhale, relax, let yourself ease out of there. One more time, and let's stay a little bit longer. So just keep deepening the contraction. I'm keeping my tailbone right underneath my crown, keeping that perfect stack, pressing, pressing, and then ease out of there. And before switching sides, we might pop up to our feet and just take a few easy hip circles. I'll lighten things up after creating all that tension, and then we'll come down to the other side. Again, find your stack, head, shoulders, pelvis, and knee, especially if you've just come up from sitting. This muscle might be a little bit asleep, can help to tap it a little bit, and then start to look for that contraction. Squeeze it as tight as you can as you exhale all the way to empty. Inhale, relax. As we contract the glute, can we maybe feel this press forward a little bit into some stretch? And on the last one, we'll stay a little bit longer. Keep breathing. And be sure it's not pressing you into any arch in the back. We're staying really long on all 4 sides. And then we'll ease out of there. Again, come on up. And if you remember which way you circled the first time we were here, let's go the other direction. Soft knees. Okay, so then be sure the knees are soft so the tail is hanging really free and long. Start with your head getting heavy toward the shoulder, and then feel this hand just gently tracing down the side of the leg until you just feel the glimmer of a stretch somewhere on this side. Now we want to take the top of the head as close to the ceiling as we can. Head gets heavy the other way. And again, just feel these fingertips trace down the side of the leg, keep that connection, and then grow tall through the crown while the tail stays long. Let's do a couple more. And again, if we go to where we feel a mild stretch, we know we're mobilizing some tight muscle. It doesn't have to be intense. In fact, it can be way better if it's not intense because your body can feel safe to let go into it rather than feel like it has to pull back and protect against it. Okay, start with your feet right underneath your hips. So we've got parallel legs. Standing tall, Unlock the knees so we have that long tailbone feeling. Now keep bending your knees a little bit more deeply, but you want to really feel like you're sliding your back down in an imaginary wall. Now go ahead and bring your hands to your pelvis so we really know where the two sides of the pelvis are. Now one knee is going to stay bent. Just one knee is going to press all the way straight, and in order to do that, that hip has to come up quite a lot. And then you can rebend that knee, the hip drops, they level out. Let's see about the other one. Push to extend that leg. Now notice, and you might have to check it out in front of a mirror, but notice if you can only do this by pushing yourself over, which is not what we're looking for. We want to feel like the hip can come up to the ribs, so we're getting a little bit squeezed together on this side, which also means we're being opened up on this side. And now, if you feel like you're able to do that and not move the upper body too much, go ahead and just try switching it off from side to side. Just let your breath be easy, and then go ahead and relax to two long legs. Good. And now we'll come down to the mat. Go ahead and give yourself some extra padding for the knees if that's helpful, and come to all fours to breathe out as we round the back. And then inhale, and you might just come to neutral again. If you decide you'd like to go into a bit of an arch, I want you to really think about that space in between the ribs and the pubic bone, and that you're just making that distance as long as you possibly can while keeping that feeling of length through the back. So just back and forth a couple times. And the next time you come into your rounded back shape, use that exhale to really squeeze the belly up and in and get deeply curved. And then let's stay here and get our deepest possible breath in. And then we can exhale to neutral or to that slight arch. And again, we'll press into the curve and we'll breathe in. Now see if you can relax your neck and just let your head fall so that the work of pushing into the curve is more in the middle and lower back and long spine. Exhale, think of this as just exhaling and relaxing. And then inhale, lift, lift, press, curl, tuck the tail, press through the arms. Easy exhale, neutral, and let's get one more of those. Big inhale into those joint spaces as we open them up, and relax to neutral, and feel free to take a child's pose for a moment here. Next, we'll look at spinal rotation. Let's lie on our backs. Let's open our arms out to a T shape and just let them relax there. Now we'll start with legs crossed, and if at any point that feels like too much, you can just have both feet flat on the floor and move the knees from side to side. Now let's cross one knee over the other. I'm putting my right on top of my left, and I'm fully crossed up, knee over knee. That left foot that's on the floor, I'm just gonna wiggle it over so it's in line with my tailbone. Now let's think about this for a second. We're actually gonna go in the direction of the knee that's on top. So my right knee's on top, they're gonna start falling to the right. But really pay attention here. If the low back is tight and I try to start to drop into rotation, it's possible that my back is going to resist twisting, and it's actually going to do a big arch out of the floor to let my knees move. So I haven't actually really mobilized my low back, even though I think I'm moving. So feel a nice long back connected to the ground. Feel equally long through the front as the back. And then see if you can feel this as a really pure spiral. Start small. Your head can fall the other way for a counterbalance, and then just fall right back to the middle. Let's get a breath in, and you might exhale as you're falling into the spiral, in part so we can feel like we're exhaling, relaxing, softening into that, and then we can get our full breath in as we return to center. Just keep going in the same direction. The knees go in the direction of the top knee, the head falls back the other way. The head falling back is going to help this shoulder, this opposite shoulder, stay anchored to the ground. So that's going to be the thing that limits, other than our comfort, how far we go. And on this last one, let's just stay in the rotation. So the knees have dropped over, front ribs are collapsing into the back. Head is really heavy back the other way. And when you're ready, float on back to the center. Let's uncross the legs for a moment. Maybe the arms slide in also. Straighten yourself out. And just do a quick scan of the two sides of your back, especially your lower back. Notice how you're connecting to the ground on each side. Okay, second side, and as I said, if the knees crossed feels too extreme, you can just separate the feet a little bit wider, and you can do a very similar thing with both knees falling side to side. Same thing, being sure that the front ribs are really dropping in and back so we stay long and we don't arch. But if you're up for it, we'll take left over right. We'll wiggle that right heel to midline, right in line with the tail. And this is a whole other situation. So let's start really small again. Now knees will go left with the left knee on top. Head just falls in the opposite direction in a heavy, lazy way. And everything falls back to the middle. Let's get a full breath in here. And exhale, dropping into the side. And again, as the head falls back, we're being sure the shoulder blade stays anchored. That tells us how far we can go exactly. And if all is well, let's go ahead and stay in it. Heavy legs falling, heavy shoulder, heavy head, relaxed neck. Exhaling the front ribs to drop through into the back. And then we're easing out of there. One more time, let's uncross, straighten out, and then do another check-in and compare the two sides of the lower back again. Next, if you have a yoga strap, grab that. Otherwise, just grab a towel or a belt. We're gonna lie on our backs again. And let's take the strap behind one thigh. And then I really like to let the elbows rest on the ground, and so then I'm coming up from underneath to grab the strap rather than like an awkward over the top. So from underneath, this keeps the arms connected to the back. Now, what I'm trying to do is completely relax this leg and let it be supported by the strap. So below the knee is just flopping down. If it's comfortable for you, let the other leg drop out as well, but it can stay bent if that's better. And then I'm just gonna use the arms. This is really all about my biceps here, supporting the weight of the leg in the strap. And I'm just kind of bouncing it forward. I'm trying to tell my hip flexor really, that it's okay to let go of the leg. So once you feel like you really have some weight in the strap that your arms are having to manage, start to turn that into a small circle. Take your time, go kind of slowly, because as soon as we speed up, those hip flexors are just gonna grab up again. We wanna feel like we're just stirring the pot, feel the ball in the socket, rolling around in this completely relaxed way, because the hip muscles don't have to do anything. The arms are doing the work. Go ahead and reverse that path. Deep breaths. You might see if you can do some belly breaths here. Sometimes softening in the belly helps us also let go at the hip a little bit better. And if we're successfully relaxing the hip and letting the leg be heavy, you'll find we can draw this big circle with the knee, but the pelvis feels perfectly quiet and neutral on the mat. We shouldn't feel like we're rocking around a whole bunch because we've let go of that connection between leg and hip. Okay, so once you've found that, you can just let that foot find the floor. Let's step the other foot in. Again, maybe press and lengthen your pelvis away from your shoulders to feel like you're straightened out again. And then we'll take that strap around the second thigh. Other leg bent or dropping out straight. Relax below the knee. You might flop that a few times to really feel that let go. And then start to think about the weight of the thigh, the weight of the whole leg, dropping forward into the strap. Biceps firing up to support. As it's feeling heavy, you can turn that into a little bit more of a bounce, and finally turning it into a circle. And it's a chance for the hip to just completely relax. It should feel good and feel like a little bit of a relief for those muscles to not have to work. Go ahead and reverse that. And once that's feeling good and relaxed, go ahead and set that down, and you can set that strap aside. Now that we've conveyed to our hips that they can let go, let's do a couple of stretches. You might want to grab a pillow. We're going to lie on one side. Once you're lying on your side, we're going to tuck our knees up into the chest, and we want to keep this bottom knee tucked in pretty close, as we grab this top foot or ankle, and we're just coming back until we feel a stretch in the front of the thigh. Now, if it's hard to catch hold of your ankle here, keep your strap and just have the strap around the ankle so your knee doesn't have to be quite so bent, but you can still pull on it at the end. Let's inhale on the forward and exhale as we come backward. And in the same way we were contracting the glute in that kneeling stretch at the very beginning, see if you can find your glute squeeze here as we're trying to really pry the front of that hip open. And maybe on the last one, we'll stay a little bit extra. Again, really look for that glute squeeze. Feel how it presses the hip point forward as we're working the knee backward. All right, let's release that and go to the second side. Okay, same thing. Bottom knee is tucked in. And the reason for that is that it prevents us from arching our backs as we're bringing the leg backwards. So bottom leg is in, top leg comes back. Using the strap. If that's helpful, inhale forward, exhale backward. Just a few more times here. Again, looking for that glute squeeze to both press the hip forward and propel the thigh bone backward. Last time back, and let's stay back here. Squeezing the glute, breathing, and release that. Okay, one more thing. Now I'm going to use this ball, but if you don't have a ball, that's totally fine. Grab your throw pillow, and if you fold it in half, it'll give you a bubble of about the same dimension as the ball. Totally works. So we're going to lie on our backs, and then we'll press through the heels to float the hips up and bring the ball or the pillow underneath your pelvis. Not at all under the lumbar, the low back. Feel how gravity is encouraging the lumbar spine to just hang like a hammock back into the floor. You might bring your hands to your front low ribs and feel them also softening. And all of that is going to cause the tailbone to angle up a little bit. So we'll keep that. We'll bring one knee toward its shoulder. So the knee's folding in and a little bit off to the side. So we feel a really easy and deep crease of the hip. And then I'm going to grab on behind that knee and keep it as close to my shoulder as I can. Now that other foot that's still on the floor is going to start to inchworm forward. And as soon as you're noticing some stretch, you can just stop and hang out and breathe. And the longer we're here, you might find that you can scooch that heel farther and farther away. But we don't want to focus so much on the foot going away that this knee starts to get pulled away from the shoulder, because that's telling us that it's changing the position of the pelvis. So hang on to that knee. You might even get a hand clasp between the two arms so you're really locked in up here. And then secondary to that stability, see where that other foot can go. Notice also one thing that we're doing is on this side where I'm holding onto the knee, that whole side of my waist is being squeezed together gently. So this other side of the waist on the long leg side, that whole side of the waist is being elongated. So as you're breathing here, you might visualize that you're breathing especially into the lung on that side, all the way down to your waist. Maybe you can imagine your breath going all the way down into that hip socket. Just take up as much space as you can. Okay, now that we've felt how much space we have between the ribs and the pelvis on that side, can we feel like we're staying just that long as we drag our foot in to stand flat? And then we can let go of this leg and stand that foot down, and then you might feel like you need to fidget around a little bit to feel centered on the ball. Second side, we're going to get that really nice, easy fold at the hip. Knee is coming out toward the shoulder. And then we get that strong grip behind the knee over there. And now we can start inchworming this new foot away. So just hang on to this knee. Don't let it go anywhere. So just keep thinking of that nice softening exhale. And as that lets go, the foot might be able to scooch out a little farther. So now not only have we reversed our leg position, notice the spine is in a very different shape. So this new knee hug side, that side of the waist is getting that squeeze together. This other side of the waist is being opened up. And as we breathe and we fill that lung up all the way down deep, again, let's be sure we're not just breathing into the front, but can we feel the side ribs expand? And can we really try to feel some expansion into the back? Now, oftentimes we will intuitively do our easier side first. So it's possible this might be your tighter side. If so, you might kind of on purpose really hug that knee in and squeeze that side of the body together extra, and then really push this long leg heel away, 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 and really feel that carry the pelvis away from the ribs. So just get a little bit extra space. Can we keep the pelvis this far away from the rib as we drag the heel in and stand that foot flat? Another 1, 2. Center yourself. One more time. Can we really collapse the front body into the back? Let the tailbone angle upward. Keep that as we press into the heels to float the sacrum up. Take that object away. Maybe we can melt one vertebra at a time. Back into the mat. And let's finish by coming back up to our feet to check in with how everything feels. With your parallel legs, soften the knees as we did earlier so that you really feel the tailbone just hang. Feel that weight at the end of the spine helping to traction and create the space between the bones. And the ribs are softened in and put away, and we're just so long through the lumbar. And then can we keep all that length through the tail in that easy way and gently stretch the legs up to a long position? Did the lumbar stay long? Did the ribs stay put away? Let's just get a deep breath in with one big shoulder circle up, back, and down. Thanks for staying with that. And if that was helpful, we would love to hear about it in the comments. And of course, subscribing to the channel helps us a lot. So please do if this helped you.